Welcome everyone to this session of Nurse Digest. My name is Margaret Dempsey and today I'm joined by Maxwell Vloeberghs from the Australian Digital Health Agency and also Catherine Hassall. Kathy's a registered nurse and a practice manager located in Eastern Melbourne. So welcome to you both. And I would also like to welcome everybody joining today on this very special International Nurses Day. So we do hope that during the day, today especially, you feel appreciated and able to reflect on all the wonderful achievements that you that have happened and you get through every single day, and we're so appreciative of nurses. So thank you for International Nurses Day. I'd actually now also like to acknowledge on behalf of APNA and also the Australian Digital Health Agency, we wish to acknowledge the traditional custodians of the lands across which we meet today and pay respects to their elders past, present and emerging. I'm speaking to you from Wadawurrung country in Victoria. So now I'll pass over to Max and Kathy to talk about the benefits of electronic prescriptions for consumers.
Okay, thanks, Marg. So welcome everyone to the session today. So today we're going to be talking about electronic prescribing and its use for consumers. We're going to go over electronic prescribing token functions as well. We're going to discuss the management options for electronic prescribing. We're also going to explore a little bit of information into active script lists as well. And we're going to look at an example of electronic prescribing as well and go through some questions and answers. So what are electronic prescriptions? So electronic prescriptions are a computer-based electronic generation, transmission, and filling of a medical prescription. So it takes the place of paper and fax prescriptions, and electronic prescribing allows a medical or nurse practitioner to use digital prescription software to electronically transmit a new prescription. Or they can also renew the authorization of the script to a patient or a pharmacy. So an electronic prescription is a digital version of a paper prescription. And during a consultation, your healthcare provider can send you the EP, so your electronic prescription, to you as an SMS or an email. So electronic prescription, as I mentioned, they are an alternative to paper prescriptions. And previously, only a paper prescription, which was signed by a prescriber, has been a legal form for the supply of medication, but changes to Commonwealth legislation in October 2019 recognize electronic prescription as an alternative legal form that medication can be supplied under the pharmaceutical benefit scheme. So electronic prescriptions are not mandatory, and there's still the option to choose paper if a patient chooses to. So having a look at some electronic prescription statistics from February this year, we can see here that over 39 million electronic prescriptions have been generated. And we have over 35,000 prescribers that have been generating EPs. So that includes your GPs, as well as your nurse practitioners. And also, if we look at the graph below, we can see that since April last year, it was below 10 million, and now we're close to 40 million. So that's quite a substantial increase in the number of electronic prescriptions. On the right here, we can also see that now we have over 165,000 people registered for active script lists to be using at their pharmacies, and we'll be talking about a little bit more about active script lists shortly. And we can see here that close to half, so close to 50% of community pharmacies have been registering patients for active script lists. So Catherine, I just wanted to ask you, what has been your experience with using electronic prescriptions?
As a women's health nurse, I would say a couple of incidences that have actually just occurred this week. I do cervical screening, and during that consultation, I take a history, I do an examination, and at the end of it, this young lady said, "Oh, and I need a script for my pill, my contraceptive pill." I was able to say to her, "Look, can't get that for you right now, but I'll talk to the doctor. I'll show him your history, what we've gone through today. And if it works for you, we can send you that by e-script. Now, she was absolutely delighted. She'd had e-scripts before, so she knew exactly how it worked. And yes, it was really collaborative for doctor, nurse, patient all together. The other example I had was a patient came in with a UTI or a suspected UTI. The doctors weren't available. She saw myself as a nurse. I was able to take a history, check a urine, do a bit of an examination, and the urine clearly did have some pathology in it. So we sent that off to pathology, and I chatted to her about what would happen next. I said, when the doctor gets the pathology results, if you require an antibiotic for a urinary tract infection, are you happy for the doctor to send that by e-script? And she was absolutely delighted. I did have to explain a little bit about e-scripts to her, but she said her pharmacy knew about it and it would be fine. So yeah, they're the two things that have happened recently. I've got a few more, but I think we'll move on.
Excellent. Well, thank you, Kathy, for those examples. And it really sounds like the electronic prescription has really made things convenient for patients with accessing their medications that they need. So yes, thank you for those examples. So when a prescriber issues an electronic prescription, they'll provide the patient with a token, and then that contains a unique QR code for the medication. And this can be sent to the patient's mobile phone. Patients can also choose to receive the token by SMS or email. And they have the option of managing multiple tokens via an app as well. So the token is evidence of the prescription, but it's not actually the legal document. But it is the key that the pharmacy uses to be able to access the prescription delivery service, which stores that legal electronic prescription information. So on this view here, we can see some examples of screenshots of a patient's SMS view. And so, so as we can see, the electronic prescription comes through as an SMS. And then once you open that message, you'll then see a link to the token. And the third and fourth images are both examples of how the tokens will be visible on the phone. So, so we can see here we have an image from ERX and also one from MediSecure as well. And so both of those are prescription delivery services that store the legal contents of the electronic prescription until that token is scanned by the pharmacy. And so the token will have some information on it, such as the drug name, the quantity, the number of repeats, just so the patient knows which medication the token relates to. But you'll also notice that it doesn't have the patient's full name. It just has their initials, doesn't have their doctor's details or instructions for the medicine. So once it's scanned, the pharmacy is enabled through their dispensing software to be able to see that full information that is required for the prescription. So having a look at some management options. So a patient can either receive an SMS or an email, as I mentioned. A patient can choose how they receive the token. It can be sent directly to them, or they may choose it's more convenient for it to be sent directly to the pharmacy, but it is the patient's choice. Or it could be sent to a carer who can receive it on behalf of the patient, if that is convenient for the patient. They can also use a mobile app to store the tokens, and they can register for an active script list with the pharmacies that are set up for the active script lists. And so that's especially beneficial when they have multiple medications. They can keep everything together in their active script list. So what is the active script list? So it's a token management solution. So a patient may want their electronic prescriptions to be in that consolidated list so that they can be more easily managed. And so the active script list is a list of all the active prescriptions and repeats that are available to be dispensed. And it removes the need for a patient to receive the tokens via SMS or email. Okay, so Catherine, can you talk us through, based on what we've discussed so far, can you talk us through some of the benefits that you've noticed that EP has given for your practice?
There's a couple, probably another one recently was we were doing a supervised rat test, which was positive.
Mm-hmm.
And in order to reduce the spread of the infection throughout the practice, particularly to the GP, reduce the use of PPE and everything, we just packed the patient back home, discussed with them that there might be some medicines that they might need to help through the infection, and that if it works for them, if it's their choice, that doctor would ring them that afternoon as a telehealth, and that we would be able to provide an e-script for them. I also discussed with them in this case that the e-script could be sent straight to the pharmacy, so that the pharmacy deliver the medicines directly to them, so that they went straight to home and not past pharmacies or anything, reducing the infection in the community.
Okay.
And another one.
Oh, another one. Okay, yep.
Another one. Health assessments. So often we've got particularly older patients who don't want to know how their medicines get there. They just want them. So where I think this has really worked for us is, with a lot of them on Webster packs, and they say, oh, the pharmacy just does it. So in this case, we're able to do our health assessment, perhaps organise a medicines review, and then send the scripts directly to the pharmacy, again, if that's the patient's choice, or to their carer or family member. And this often works so well with the e-script.
Okay, thanks, Kathy. From what you've said, it sounds like that it really does help with preventing the spread of infection. So the patients aren't actually coming into the practice to see the doctor to get the script that they need. They can actually do everything over the phone and through electronic prescribing. So that's another great benefit of using electronic prescriptions. Okay, so how do patients use active script lists? So to set this up, if a patient wants to set it up, they can actually attend their preferred pharmacy and they can request to be registered for an active script list. So they need to accept all the terms and conditions, agreeing that those prescriptions will be going to their active script list unless they withdraw their consent. So they still do have control over it as well. So the patient would then attend their preferred healthcare provider, receive a prescription, and that electronic prescription can be provided automatically to the active script list, unless they ask their doctor not to add it to their active script list. So the patient doesn't need the token, they can receive one if they want to, and the patient then presents to their preferred pharmacy, validates their identity, and receives their medication. And if there are repeats, they're also added to the active script list, depending on the patient's choice. So how do patients use the electronic prescriptions? And here we have, to talk a little bit about this, we have an example. We have our patient, Tracy, who takes multiple medications, and she has a few tokens, as well as she has one paper prescription repeat left. She likes to use the tokens, but sometimes she has difficulty using her phone, finding them. And so she really likes the convenience of not having to keep track of those tokens on the phone, or to keep the paper prescriptions, and she can have everything within her active script list. So the choice of using the active script list really works well for Tracy. So just note that pharmacy assistants can also recommend active script lists and register patients for active script lists as well. So it doesn't have to be the pharmacist, and sorry, it doesn't have to be the regular pharmacy that registers her. It could be any pharmacy that they choose to go to. So if the patient is new to the pharmacy, they'll just need to confirm their identity when they're registering. So in our example, Tracy's pharmacist, Ken, suggests that she registers for the active script list. So she doesn't have to worry about finding those tokens every time she visits the pharmacy. So she completes her ASL registration and she presents those 100 points of ID, which is part of the requirement. Tracy then accepts the terms and conditions and confirms the historical upload of her active prescriptions. And then Ken sends her an SMS, so the pharmacist sends her an SMS to request access to view her active script list. Tracy grants that access for ongoing access for her pharmacist to that active script list until Tracy chooses that she wants to end the that ongoing connection to her active script list. So this could occur as well. So in our example, Tracy actually ends up leaving town to visit her daughter and to help look after the grandchildren over the school holidays. So she's due to have her medications refilled and she visits a different pharmacy from the one that she has registered with the active script list. She has one repeat on paper, which she also brought with her, and the others are still on the active script list with the other pharmacy. So she asks the pharmacist if they can register her, so then she can then access the active script list and they can dispense the prescriptions as well. So after Tracy has it set up with this new pharmacy, she's then able to access her medications as well. So it's a great option to mention to your patients to register for active script lists, especially those that have difficulty keeping track of their medications, and they can still receive the tokens as well, and they can manage that with their healthcare providers. Please feel free to check with your pharmacy if you can set up those active script lists. Okay, so Kathy, what have you had much experience with using the active script list, or have your patients that you've worked with in the past been using the active script list?
I would say my example of my person with the health assessments, one of our typical times when we discuss active script lists with patients, particularly with their carers there, because often they've got family members picking up scripts and things like this. It's also a collaboration with pharmacies, because often our elderly patients particularly already have a very good relationship with their pharmacy. So we talk to them about going into the pharmacy and they'll help them register for the active script list. And it saves that confusion of one script I need every 3 months and one every month and whatever. We encourage them to put them all on the doctor will put them all on the active script list in collaboration with the pharmacy.
Mm-hmm.
And particularly when they're on Webster packs, because then the pharmacy can just have the scripts they need and the patient just gets their medicines. And as I said, that's all they care about. They just want their medicine that they're supposed to have.
Mm-hmm. And in the most convenient way for them to get their medication. So
yes, especially when they're on, 4 or more medications, it's really helpful.
Mm-hmm. Yes. Okay, thank you very much for that, Kathy. Is there anything else that you wanted to share with the audience about electronic prescriptions? Otherwise, I'm happy to move on to the next part.
I think very quickly, I think just as far as safety and reducing errors, you don't have that script sewing and pickup box at reception where things can get lost or go to the wrong person. I just think it's a much more fine-tuned way of moving requests.
Yes, definitely. I mean, it's so much better than the previous system where everything was written on paper. Sometimes you couldn't read what the order was, and patients would end up with the wrong medication on occasion. So having everything electronic is so much safer. And as you said, yeah, just reducing those errors as well.
And faxing, I often used to wonder where the fax was going to end up, but when everybody has a specific number to send the e-script to, and the patients are often there and they go, yes, I've received it, thank you. It's just reduces errors.
Yep. No, absolutely. Thank you for sharing those examples with us, Kathy.
Can I just add in?
Sure.
Max, I've just received a message and someone's said that the value of electronic prescriptions, it gives people options. It's so convenient and it gives them choice, and that's really the key message, isn't it? I thought that was a great summary of it provides convenience and it gives people choice.
Yes, no, absolutely. Thank you for sharing that. Okay, so just to finish up, I just wanted to show you some of the resources that we have available on our website, and that you can access at any time if you want to go through any further training. If you do have any questions, please feel free to email us at thehelp@digitalhealth.gov.au. Otherwise, you can also go through to our website, digitalhealth.gov.au, and you can also call us on the agency helpline if you have any questions around the use of My Health Record or digital health services. And I'll just show you what the resources look like on our website. So when you open up our website, we have details for everyone here, but those would be more for consumers. But for healthcare providers, you'll just be clicking on this tab up here. And now you can see all of the different resources that are available for healthcare providers. So we have aged care resources, allied health, community pharmacy, practice management. So depending on your area of health, you can find a lot of resources here. We also have information on electronic prescriptions, My Health Record, telehealth, secure messaging. So there are a lot of resources on our website. And we have events and webinars section as well. So if you'd like to register for any of our upcoming events, I'd highly recommend having a look at what kind of webinars we have, and you can register for those and receive an email notification that you have been registered. We also have online training courses, which you can do. So if you're interested, we have modules for nurses to do around the use of My Health Record. We also have using My Health Record in general practice. We have introduction to active script lists, as well as electronic prescriptions for your practice. So as you can see, there is a lot of resources on our website. Otherwise, please feel free to contact us if you do have any questions. We're always happy to support you if you do have any questions. Okay, so now I will hand it back to you, Marg.
Thanks, Max. What a great presentation. I always love your presentations because your slides are so clear and showing what the token looks like on people's phones and the different versions is just really helpful. And we record these Nurse Digest sessions and they're available on the APNA website as well. So 30 minutes long, and you can have a look through, and that can help you as well. But the Digital Health Agency has lots of resources, as you've shown, Max. So I really enjoyed listening to the session. Great to hear Kathy's responses from a practice nurse point of view, but also a practice manager point of view. You'd be right across a lot of it, Kathy. So thanks very much for joining us today. We just going to launch a poll right now, just with some questions and evaluation about today's session. So we appreciate you being able to complete the poll, which should be appearing on your screen now. So thanks very much to Max and Catherine, and thanks for everybody for joining us on International Nurses Day today. We do look forward to having you join us at the next Nurse Digest session, which will be on the 9th of June. And we will further explore the use of My Health Record. So thanks very much, everybody. Bye for now.
Thank you.